Good morning. My name is Nicholas. I'm 34 years old. Tomorrow, December 16th, 2022, I'm having a Hida scan done to see if my gallbladder or bile duct or emptying into my small intestine is causing a lot of the issues that I've been having over, golly, over over a while. I'd say over the past couple of years. Um, it really started probably about 2.5, 3 years ago. I started experiencing abdominal pain that would start like right here in my left side, where my stomach was in the rib cage, and it kind of moved up, like felt like it was coming up the esophagus and into my throat. Of course, it makes my chest hurt pretty bad. And over the years, it kind of has gotten worse, comes and goes. At times, I get high heart rate. My heart rate has gotten into the 160s, just sitting still. And when it happens, I feel like I'm on an elevator ride and I'm dropping really fast. Like, it's like everything just suddenly drops. And when this happens, I, uh, I kind of freak out a little bit, and it makes me really uncomfortable. And I get lightheaded and dizzy. So it used to be like maybe once every couple of months, or after I ate something like cookies, or, and I don't really eat fried food, but maybe some processed meat like sausage or a hamburger, which I really don't eat either. I was a fitness instructor for over a decade. I'm very self conscious about my health and taking care of myself. I know that my family has a history of digestive and heart problems and things like that. So ever since I was in my late teens, I've been very proactive with trying to take care of my health, physically and mentally. Anyways, the symptoms got to where the nausea started coming into play too. So it is December 15th as of today. Had my Hida scan done on December 16th. About 3 months ago in September, I had an EGD done, where they go through your esophagus with you sedated under propofol, which I was, and they spent 24 minutes doing a process where they went down into my stomach, my duodenum, uh, pulled a sample, took a biopsy from my stomach to see if I had Crohn's disease or um, anything that would indicate a marker of ulcers, costochlearitis, or anything like that. Um, and it all came back that everything was good. They said I had a lot of mucus draining down there, but otherwise everything was good. So before that, about a month prior to that, I was every couple of weeks getting severe pain again down here in the left abdomen side, the upper rib cage. Like right here is my rib cage, and right here is my sternum where it starts. And it was on the left side, and the pain was just like severe. It's not like a sharp pain per se, it's like a dull aching and then burning at times pain, and it makes me sick. Sometimes it would move over to the right side. Um, and I thought, you know what, maybe it's just the food. I have GERD. I've been diagnosed with GERD, costochlearitis, inflammation of the chest wall, off and on. Of course, I have with GERD is severe acid reflux, gastroesophagus reflux disease, esophagitis reflux disease. Forgive me for butchering those words. I try to do my best. But it got to the point, it was so severe, um, following the EGD about 2 weeks later, that I was getting headaches. I was getting a lot of pain in my neck. Felt like right here, where I guess where my adrenal glands were swollen. That's what it felt like, and it hurt really, really bad. I was getting a lot of back pain, but the thing is I already have back issues. I have degenerative disc disease. I have a ruptured L5. I have horrible thing called Curie malformation for those who are watching and have a Curie malformation. Um, Mine is extended pretty far. I've been diagnosed about every year. I go have an MRI done of my brain and my neck, my cervical, to see if it's changed any, but mine's extended and it's pinching C1, C2. I've had this most of my life. It has progressed and gotten significantly worse over the years, so to say. Get a lot of tingling, numbness in my hands, radiating down to my feet, a lot of pain in my shoulders. So it was hard to distinguish if the pain was related to this area and whatever's going on here. Well, I thought that I was doing good. Back in October, about October 20th, which would be about 2.5 months ago, or a month and a half ago, I I was sitting there looking at my phone, just scrolling casually, not really doing much, and looking down, and all of a sudden my heart rate just boom went up. The nausea came back. The severe pain down here came back. The pain in my traps or subscapulaire, that area came back, and it was so severe, it freaked me out. Of course, I have Apple iWatch, as you can see, um, and my Apple iWatch is 6, Series 6, 44 millimeters. I did the little AFib thing, and it said I was in AFib. My heart rate was in the 160s. I thought I was going to pass out, kept getting tunnel vision, felt like I was dropping on an elevator. Went to the hospital, uh, did the EMS. They took me, did the whole workup, and of course, everything came back normal. Not the first time. This has been happening for a few years, and quite honestly, it's caused me to have some financial problems with that, because you keep getting all these people saying that they there's nothing wrong, it's anxiety or it's bad acid reflux or something. So I thought, okay, well, I don't know what more I can manage to change my diet, because I'm already practicing the FODMAP diet, FODMAP diet, which is bland food. More fiber, less fat, lean meats, less citrusy foods, less acidic foods. I did that, and I've done omeprazole on and off for years to help manage my acid reflux, which it does help. I'll do a cycle for about 2 to 3 months, and then I'll take about a month or two off, because honestly, it just makes my joints feel weak, which is a side effect of esomeprazole and omeprazole. It can cause you to have weak joints. So that's why I cycle it on and off. Famotidine, as we know, is generic Pepsid. And Tums, whatever the case may be, has helped it. But for the most part, I eat a very balanced diet. I'm not keen to eating a lot of fatty foods. I used to be when I was in my early 20s, but not now. So over the years, I've helped to try to manage my symptoms, and I've gotten to where I felt like I was doing better and doing great at times. But then it just got worse. So after that episode with the hospital, I was like, okay, well, it's been happening about once a week. Let's see what happens. It actually started happening every single day. And for the past month, I'd say since first week of November, pretty much every time I eat, it's gotten to where the pain, it will come down, it will radiate from here, and it'll just be bad, sour pain. It feels like I'm just sick. I get so nauseated. I get these spells of dizzy spells. So I start checking my blood sugar. At times, my blood sugar would spike, but that's normal. After you eat, it can spike up to 150s, 160s within 90 minutes of you eating, and it should come back down to normal, which it does. So I was checking my blood glucose regularly. Didn't think that was it. Maybe, possibly waking up in the mornings, severe nausea, feel like I'm gonna throw up. Sometimes I did. I upchucked in my mouth and swallowed it back down, because I'm pretty self-conscious and don't like to puke. Anyways, did all this. It got so severe at the time with the pain that uh, my grandfather was getting checked out at the ED, and I had to go myself. I just went and checked in because the nausea was so bad. Seems like anything I eat or drink, it just makes me super nauseous. And I was like, you know what? they got to rule out something. So they did a CT with contrast. They wanted to rule out my kidneys because the physician thought that my adrenal glands were inflamed. They, from the pain where it was radiating in my left kidney, they wanted to take a look at that just to rule out that I don't have kidney problems. So I did the CT with contrast, which, by the way, if you ever had one, this was probably my fourth one I've ever had. I've had about a dozen MRIs and Lord knows at least 100 X-rays and about half that of CT scans from all the stuff I've been going through. Skateboarding for 15 years on top of all this probably didn't help out very much, along with bodybuilding. Anyway, they did the CT with contrast. They said I had a very small cyst on my left kidney. Everything else looked fine. I've been from medical professional to medical professional. I trust my primary care. They've been great. My primary care team has been wonderful, but still no clear answer. So my primary care thought maybe, okay, you know what? Let's check to make sure you didn't have a reaction to anesthesia. So I did the thing where I urinated in a 2-liter container with some hydrochloric acid in it for 24 hours. Test results, they say, came back normal. A little bit low on one of the areas, but I trust that they say it was normal. It was normal. Saw another MD who, wonderful bedside manners, who showed me my CT with contrast, pointed everything out, said, okay, this sounds like your gallbladder. Even though it's the left side, this sounds like your gallbladder. And I do have a family history of having my gallbladders being removed. My mother's side of the family, pretty much everybody has had their gallbladder removed. From her to her parents, etc. And it's, it's not that it's not speculated, but it could be. Anyways, tomorrow I'm having my Hida Scan done. I'm a little bit nervous about it, but I've had so many over the years. I feel like this is just going to be another one, hopefully to rule it out. But if there is gallbladder issues, take it out. Help me feel better. I'm ready to return to work. I'm actually studying to be a counselor and a therapist, clinician. Would like to become a psychologist. I want to work with people with nervous system disorders and use my knowledge and experience, and I've learned over the years to help people with nervous systems disorders, because when you're going through issues medically like this and you get a lot of uncertainty and you get a lot of diagnosis or misdiagnosis, you have a lot of unanswered questions and you want to know exactly what's going on. That can bring on a lot of anxiety. If you're familiar with CPTSD, complex post-traumatic stress disorder, I believe that comes from that as well. And I also want to work with people who have grown up in broken homes or have things that happen in their childhood or adolescence years that affect them negatively. Subconsciously, these memories are repressed. They come about as adults, and it can cause central nervous system disorders. Polyvagal theory points to some of those characteristics. I want to help shed light into that, because there's a good possibility that if the results come back normal, that this could be results of anxiety due to acid reflux. And when I had a moment, or you have an episode happen at a current time where you are, say, in a place like I was when I was sitting on my back porch looking at my phone, and then I felt like I was dropping like an elevator. Maybe I had a slight change in blood pressure. I do have a Curie malformation, which some of the symptoms can be where the thalamus, which is where the Curie malformation is, and the hippocampus, it regulates your blood pressure, heart rate, etc. It can cause PVCs, premature ventricular contractions, and PACs, premature articular contractions, which I've had both those for many years off and on. Maybe I had one, and then maybe the nausea because I was having some acid reflux from something I ate that was really salty prior to it. Could have all correlated into it and caused some CPTSD, complex post-traumatic stress. And it was association or disassociation related to something that happened cognitively before, and my subconscious was able to relate it to it. As a clinician, that's one of my goals, is to work with people with issues like this and to help their families understand them. Because at times when you keep getting these diagnoses and then the doctors just throw up their hands and say, hey, you know what? There's nothing wrong with you. And you don't want to take Effexor or Lexapro. I've been on those. I've been on a Lexapro before. Don't want to take Effexor or Depakote or any of the other benzodiazepines or the opioids. You just want to feel good, exercise, study, work hard, read, write, play music, whatever it is you do. You just want to do it at least 75-80% of the time, and feel good. But for those who are like me, who have had this roller coaster ride for many years and a lot of unsolved questions, then you want to know, is it cognitively, and if it is, what can I do? And as a clinician, I want to help. I want to help out in that factor. There's forms of therapy that can help out with helping people like that, like disassociation. There's what we call solution focused therapy, cognitive behavioral therapy, interpersonal cognitive behavioral therapy, rational emotional cognitive behavioral therapy. The list goes on, and depending on the clinician, they can help diagnose and treat many of those issues, but particularly someone with CPTSD experience would be someone you want to reach out to, because they can use some types of physical things like touch, EDMR, which if you want to look it up, it's a reaction to touch and repressed subconscious memories that come about. Sometimes these therapies can help change what you're going through and maybe minimize a lot of symptoms. But even if you have issues and your body doesn't feel good, you still need someone to talk to. And I hope to be able to do that and inspire other people and to work with them professionally. But I will keep you posted December 16th about how to Hida Scan. It may take me a few days to post, but I'll let you know how it goes, and hopefully it goes well. Honestly, I pray that it comes back normal and that it is all subconsciously up here. If it is, I feel like, going through my mid-30s, I just graduated from my undergraduate degree in counseling psychology. I am an open-minded believer, but I don't judge people for what they believe. I'm very open-minded and as well as influenced by other cultures and religions, but I want to really just help people. I do like to talk, but I love to listen, and I'm very observant, and I'm very empathetic and compassionate. So my experience, I hope, will reach out and help other people. I appreciate you taking the time to listen to this. It's only one step in the many steps and other processes. I'm going to make some clips to show you some of the things. Hopefully I can add it into this video. So if you see the clips in this video of the Curie malformation, the scans, things like that, and the blood work and things like that, please note that this is mine. Everybody's experience is different. Everybody's averages are different, but the laundry list goes on. So for those who are suffering, I understand, I can relate. I'm 34 years old, overall pretty good health, fractured a lot of bones and got some back problems and neck problems, but for the most part, I've been very proactive over the years, managing my health. I love being proactive. Oh, to include, I also lost, on average, about 15 pounds from this whole process, and I'm eating regularly too. Which is another question as to what's going on. And I'm back to exercising. Though I don't feel so good, I get nauseated between it, but we'll find out. And if it is my gallbladder, they can take it out, and I'm still going to continue to try to help people. My name is Nicholas. Thank you for watching. Nicholas Reinhardt, if you look for me on Instagram. Thank you for watching.